So what are sexualized attachments? When attachment drives become fused with sexual drives, that's what we would call sexualized attachment. So just to explain that a little bit, everyone has legitimate needs for bonding and attachment that are inherent from birth. Our craving for connection is a survival mechanism. It's wired into our genetics. The needs can't be avoided, but those needs are often wounded or neglected. And in that scenario, a person becomes more vulnerable to having legitimate needs for attachment become sexual in nature. Similarly, it's common for other emotions to become sexualized when they are related to attachment wounds or deficits. Abuse, abandonment, or neglect are common examples of situations that can generate attachment wounds. They might leave a victim feeling intense fear, anger, or confusion, which then also becomes part of the sexualized attachment issue. Sexualized attachments are easily observed in more severe scenarios. So for example, if we talked about a child who was sexually abused, InSync in 2020 observed that childhood sexual abuse was often associated with sexualizing problems later in life. A victim of abuse may find themselves as an adult seeking out sexual activity that mimics the abuse, and that's called trauma reenactment. This re-victimization was observed by Trickett in 2011, by Doyle and Cacchetti in 2017. It's widely researched. Another example could be a child who is abused by an older adult, then later in life seeks out sexual partners who mirror the persona of the adult who abused them. This type of behavior stems from what we understand to be a trauma bond. And a third example could include a young teen who's abused in maybe forceful ways that incite high levels of fear, and then finds himself as an adult looking for sexual activity that might engender fear or is dangerous or sadistic or masochistic in ways. You can find more about those kind of dynamics thanks to the research of folks like Patrick Carnes, Schwartz, and Galperin or Whitfield. And so why does all this happen? Well, attachment drive and sexual drive have a very similar objective. It's all about connection and union. Attachment drives are all about emotional bonds and intimacy, connecting on psychological levels for survival of the species, while sexual drives are all about physical bonds, sexual intimacy, connecting on physical levels for survival of the species. So essentially they both have the same goal, the same direction, just coming from a different angle of approach. So understanding this makes it easier to see how those two drives, sexual and attachment drives, can easily become fused together. Confusion can be the biggest struggle for someone with sexualized attachments. The sexual feelings that are moving in various directions may cause a person to question their identity, their orientation, and even their general sense of who they are. Over the years, I've had clients experience deep depression, anxiety as a result of the confusion. And while it can feel overwhelming, it's important to keep in mind that all of this stems from the legitimate attachment needs that have been wounded or in deficit. In attempts to resolve the confusion and emotional pain, people often turn to alcohol, drugs, or sex as a way of coping. Compulsive substance use or behaviors is similarly an attempt to resolve the psychological pain that comes from the wounds and the deficits. Unfortunately, alcohol, drugs, compulsive sexual behavior doesn't resolve the core wounding. Unresolved pain can cause a person to return to the coping behaviors over and over again, and over time that compulsive pattern sets into an addictive mode. So essentially, just to be very simple about it, sexualized attachment is the sexualization of legitimate attachment needs and how they get fused together. So what was once exclusively an attachment or an emotional need now becomes a sexual feeling because they've been fused together.